most common intracranial complication of rhinosinusitis. Options are subdural empyema, brain abscess, meningitis, cavernous sinus thrombosis. Answer of this question is the subdural empyema is the most common complication. Second most common intracranial complication is the brain abscess, and brain abscess most commonly occur in frontal lobe in rhinosinusitis cases. So most common complication of rhinosinusitis is the subdural empyema, and second most common complication is the brain abscess, and brain abscess is most commonly in the frontal lobe. So frontal lobe brain abscess is most common brain abscess in rhinosinusitis cases. And most common complication of rhinosinusitis is the extracranial complication, that is the preseptal cellulitis. So preseptal cellulitis means orbital complication are more common than the intracranial complication. So overall most common complication of acute or chronic rhinosinusitis is the preseptal cellulitis. While in otitis media, most common intracranial complication is the meningitis, and most common extracranial complication is the post-auricular abscess. So this is the difference between intracranial complication of the rhinosinusitis and intracranial complication of the otitis media. So overall complication of rhinosinusitis divided into three categories: orbital complication, intracranial complication, and local complication. In local complication there is two parts: bony complication and chronic complications. In orbital complications are preseptal cellulitis, which is most common, postseptal cellulitis, subperiosteal abscess, orbital abscess, and cavernous sinus thrombosis. Intracranial complication of subdural empyema, intracranial abscess, extradural abscess, meningitis, and cavernous sinus thrombosis. Bony complication are osteomyelitis, spots, puffy tumor, and chronic complication are mucocele and pyocele. So these are the complication of acute rhinosinusitis or chronic rhinosinusitis. These complications are common in children and adolescents because of their thinner, more porous bony septa and more porous sinus walls, and there are open suture lines and larger vascular foramina. That's why these complications are more common in children. Intracranial complication is most commonly because of frontal sinusitis, followed by ethmoid sinusitis, followed by sphenoid sinusitis, followed by maxillary sinusitis, and most commonly it is because of hematogenous spread of the most common mechanism. Subdural empyema is one of the commonest intracranial complication of rhinosinusitis, typically from hematogenous spread. And frontal lobe abscess are most common intracranial abscess in cases of rhinosinusitis. Management of complication cases are required medical as well as surgical approach. All patients with complication of rhinosinusitis should be admitted and keep for observation and medical and surgical treatment. After clinical endoscopic evaluation, if there is no visual loss, no significant proptosis and restriction of eye movement, then you can give antibiotic IV followed by oral antibiotic. If there is any sign of intracranial or orbital complication is there, then you have to investigate by CT scan as well as with MRI. If you find any intracranial or orbital complication and decreasing vision is there or restriction of eye movement is there, then you can proceed for endoscopic sinus surgery immediately, and followed by, if there is intracranial complication is there, then surgical drainage of this abscess is mandatory. So depending on the complication, surgical as well as medical treatment is required in the complication of rhinosinusitis.